Happy Saturday afternoon to you all. I am Sanjeev Pandya. Namaskar, hello, and welcome to the Ayurveda Mantra Show by Santigram Kerala Ayurveda Wellness Center, USA. In this weekly show, as you know, viewers, that we talk about Ayurveda, how important is Ayurveda and how it can help you to live happy and healthy life. And of course, Santigram Kerala Ayurveda Wellness Centers in the USA, they've been helping many people from our community as well as outside of our community to live them happy life. And in this episode, once again, I'd like to welcome Dr. Ambika Nair of Santigram Kerala Ayurveda Wellness Centers in the USA. Dr. Nair, welcome to the show once again.
Namaskaram, Sanjeev. I'm really happy to be here again, and real namaskaram to my viewers.
Thank you for actually being part of the show and educating our viewers with this Ayurveda. Talk about viewers, Dr. Nair, some of our viewers have contacted us and they actually requested us, heartily saying that can you please talk about Trigeminal Neuralgia?
Yeah.
Is this a big thing? I mean, is it like there are many people out there with this kind of condition?
Yeah, it's not that like an epidemic.
G.
Okay, trigeminal means that is one of the, like the cranial nerves. Okay, this is the fifth cranial nerve.
Which actually gives you headache and facial pain?
No, actually, I'll tell you. See, fifth cranial nerve supplies to the upper part because it's like divided.
Correct.
Okay, and it supplies, like it's on the base of the brain. Then, upper part like our nose, ear, all the jaws, eyes, all the facial muscles.
And is it like a severe pain?
Normally it doesn't, because this gives supply to the, like all these areas which I told you now. But when there is a block, the causes are there. See, first of all, like they will tell, like they cannot open the jaws. That is the first thing what they will tell. Like a trembling sensation, and the pain will be like, see, it will be like a misled also, like they will have severe pain. It is a progressive pain sometimes. Okay, so sometimes it is with a vibration and like a stabbing pain where they cannot tolerate. They will be shivering, they cannot even a small noise or anything, means like a death, that pain will be like.
Okay, and how often that pain would come back in a day?
There is nothing like that. So
really?
Some people, even the medicines doesn't work. Few days it will work, afterwards it stop working. Very, very difficult. They cannot get up. They cannot even touch themselves. They like analgesic or something, they just sleep off. Very difficult situation. We get a lot of clients like that, actually. Okay. I should say that. A lot of means, at least in this, after, in 10 years, I must have treated like around 45 to 48 patients.
Okay, so you definitely have noticed some kind of rise or growing number of people of this trigeminal and neurology. Okay, and what causes it?
It is a nerve disorder, actually.
Okay.
This pain is not like that. It is the cranial nerve. So it is always related with the brain, you understand? So the cause can be, like some blockages over there, some injuries to the nerves. Some people complain only the earache. Then it comes like this, travels like a lightning, and when they go to their doctor, they will tell that you go for the MRI, and some cases you can see that there will be a compression of the nerve to the blood vessels, which make your life so miserable. You cannot do anything.
Gotcha.
Yeah, very difficult, means your all functions are totally out. Yeah.
And then how do you test for this trigeminal neuralgia?
These cases, because nobody comes directly to the Ayurveda, sincerely telling. Because I always get the chronic cases only, because they must have gone for the surgery, they were suffering, like recently one guy, he was referred from Delhi to me. Okay, idhar aaya, he was like 15 saal ho gaya. So he tells me, when I know you will be listening this, okay, when I get this pain, I do the, मैं तो तबला बजा देते हैं. I told God, that is something. because he is a very spiritual person. He is fed up of this, and then he came to me. Then he was not at all willing to come for a consultation. First of all, I told him, "ठीक हो जाएगा, आप इधर आ जाइए. Let me see whether I can do something for you." Okay, he is a very anxious person. It is always with the nervous system.
Is it more in men or women?
It is more, I have seen in men than women, I should say.
Achha.
My practice.
Okay.
Yeah.
And what about age? Does it start at
The
very young
age was
or
always,
mid-age?
after 45.
After 45.
Yeah, only like one 18, 19-year-old, like I have seen that, like 2-3 cases only. Otherwise, everybody was within Delhi and all. We have seen a lot of cases, but I'm telling about this 10 years of experience. Yeah.
All right. We should discuss causes of it. What really causes it?
Yeah.
And
I will come to that.
why is there so many people getting affected with this trigeminal neuralgia?
Yes.
And is there a cure? And can it be prevented? I think we should talk about this more after we take a break. You're watching Ayurveda Mantra Show by Santigram Kerala Ayurveda Wellness Center, USA. We'll be right back and we'll continue to talk about this trigeminal neuralgia. Welcome back to the Ayurveda Mantra Show by Santigram Kerala Ayurveda Wellness Center. We're talking about trigeminal neuralgia. This is the disorder which causes a pain in different parts of face. They call it facial pain, as Dr. Ambika Nair of Santigram Kerala Ayurveda Wellness Center mentioned right before the break that it could be a severe pain and it could last anywhere from 30 seconds to a minute to God knows how long, yes, and it could come back again and again. Doctor, with that note, I want to know that how do you test for this trigeminal neuralgia?
See, in Ayurveda, what we see is that because their vata will be on the higher side, okay, like a morbid vata.
Achha.
Okay, so like because the movements are like it will be totally, it is not there, like continuously going.
Correct.
Okay, these people are like very anxious personalities because it is a neurological disorder. And like your eyes will be affected, your nose will be affected, your all these muscles will be affected because it is from the nervous system which is compressing, understand? So this all, then like when they come, I'll tell you. Okay, so we see that how to diagnose them properly and treat for the cause. What we do, we have like very special treatments for that. Like Shirovasti is there, Nasyams are given, even Shirodharas are given in Ayurveda. Then like with the Shirodhara, I have seen that patients responded very well. And even Shirovasti also, it will help a lot.
Okay.
And they tell that now, like the pain, it has reduced in the sense intensity has reduced. Who were taking the medicines for a long time, they have started reducing. They go to their doctor also. I tell them that you go to your doctor and see that what they are telling, okay. Because after surgeries only they come to me actually.
Achha. Talk about surgery, doctor. To be honest with you, I really don't know anyone who is affected with this trigeminal neuralgia.
I'll send you some.
Not that I really want to know, and I feel bad for those individuals. But however, I do know 1 or 2 celebrities from Bollywood. I think they have this disorder.
Yes, I know it.
We shouldn't mention the name, but that's what I have heard about it. But now, while you're talking in detail about this trigeminal neuralgia, right? And I'm thinking about what I have read about that celebrity online and in the publications and whatnot. Let's talk about surgery. Why do people go for surgery when they have this facial pain thing? Where is the surgery and why is it needed?
Because actually, the blocks, like they will just block that area.
Achha.
That's all.
Okay.
Yeah, with the surgery, like this all lesser surgeries what they do.
But how do they find the area? Since you
No,
say the pain could be
MRI. Yeah, that only they will do it.
Okay.
And not only that, even one time, how many times they do, how many surgeries they can do. Yeah. And like as people think, when these things happens, only that is the ultimate treatment. Actually, they don't know much about Ayurveda. Sincerely, that's what I thought I will talk to you. You were very good in selecting the subject also.
Thank you.
I have to really thank you, Sanjay.
And it goes to our viewers also, they wanted
because
to
actually, lots of cases are coming to us these days because I have treated this. See, this guy I have treated now recently, just a few days back only. He after he completed the treatment. So he has sent me like 3 more cases now. because it is like a word of mouth, like, because how you are treated like this. I treat so many other cases as not only this trigeminal neuralgia.
Correct.
Okay, and we give medications also.
Okay.
Herbal medications, not like herbal supplements, which is needed for them. It all depends upon the person. Again, I am telling, because it's not that the same can be given to the other person also, because it all depends.
Okay.
Yeah.
Now, before we go into medications and kind of therapy at Santigram Kerala Ayurveda Wellness Center, USA, let me ask you this question. Let's say for a second, hypothetically speaking, had it not been for Ayurveda, and if person has to rely on this allopathy or the pain medications, will they have to be on it for rest of their life?
Because I told you, recently this guy came to me, he had this issue since 15 years. He is on continuous medications which has affected his, like work also. He was telling, I don't go so many times. I told he plays the tabla. So he was telling, like, because how to come out, I cannot sleep. But one best part is that it doesn't come in the night, 90% of the cases. The pain doesn't come in the night. Okay, mostly because this is that anxiety which is built up. Your vata is moving, not in your control. You understand? That only creates all the. Sometimes it goes like it is all the swelling. I have seen that cases like that. They cannot even open their eyes. It's all like their ear.
Wow.
Like it's very difficult. They can't even eat. No noise will work on them. It's very, very, very different situation.
Okay. Since you mentioned anxiety, and obviously anxiety and stress can also be part of that, and before the break you said that you have seen more people, rather more men with this trigeminal neuralgia, right?
Yes.
Could it be stress related? When you're really stressed out, usually, so there is. Okay, that's why more men are affected with this.
More men. Why? Don't say ladies doesn't have.
No, I'm not saying that, and I'm not doubting that fact. But as per what you said, that more people, there are more men with this.
I have seen more men.
अच्छा.
Yeah, I should say that.
Okay.
Means आदमियों को बहुत ज़्यादा देखा है जो ट्राइजेमिनी प्रॉब्लम लेकर आया हुआ है. It's very, very disgusting, I should say that.
Okay.
Yeah.
Well, anyway, talk about treatment, prevention, and a cure. We're going to talk about that right after the break in this Ayurveda Mantra show by Santigram Kerala Ayurveda Wellness Center, USA. Welcome back to the Ayurveda Mantra show by Santigram Kerala Ayurveda Wellness Center, USA. Dr. Ambika Nair of Santigram Kerala Ayurveda Wellness Center, who has cured hundreds of thousands of patients in her almost 30 years of career, and then we're actually finding out the benefits of Ayurveda, the importance of Ayurveda, and how it can prevent or cure any disease, and then that actually can lead you to happy and healthy life. In this episode, we're talking about trigeminal neuralgia, a kind of disorder which causes a pain on a face, anywhere on a face. It could be on a head, on the side of the face, in the ear, and whatnot. And Dr. Ambika Nair, who's been giving out more details on this trigeminal neuralgia. Doctor, what are the side effects? Are there any side effects to this?
Yeah, because actually, like I had a few clients who came to me from the age group of like 19, 20 and all.
Wow.
See, like such one case, because actually I have seen that maybe in my journey that it has led to multiple sclerosis actually. So this blockage was there, it's a blockage actually, and she was finding it very difficult. This neuralgia can, like it will come to the eye also when it is on the maxillary, like a submaxillary and ophthalmic, it will come to the eyes also. It is very difficult to open your eyes.
Okay. When we talk about prevention and how Santigram Kerala Ayurveda Wellness Center, USA can guide and can help those people out there with this trigeminal neuralgia, what is the most important thing?
You see, most important thing is that any headache or anything like that, people do the self-medication. This has to be, avoided. See, you have to treat for the cause. Whatever, if this pain, just like the one headache, that is okay. But if it is continuing for like 3-4 days in a row, then they should always go to the doctor, and self-medication it should not be taken actually. they will ask, they will also give some medication, painkiller only. It's not that, at least you can rule out, what's the root cause of that, whether it is related with any, like a cancerous or anything like that, that can be taken care of.
Okay.
Yeah.
Any diet or anything needs to
Diet
be?
also, like, because they should not take anything very cold.
Acha.
Okay, very cold means it will aggravate the pain. Try not to eat any uncooked food. It should be cooked food, and whether it is vegetarian or non-vegetarian. Okay, some days, like, because when you take a lot of painkiller also, because it will affect the liver, then like your digestion also will be like haywire. So this is also another important factor.
Acha.
And their sleep. So many people are there who goes for cinema, shooting, all those things, because they should not be allowed to sit for a long time in the night,
Achha.
Yeah, that their sleep should not be disturbed a lot. We have so many celebrities like that.
Exactly,
Yeah.
exactly.
In Ayurveda, whatever the treatment we have meted to the people, it all was very successful. I told you about the that a boy was there, like because there was a stress, because he's lost his parents, okay, in a car accident in US, born in South, like Africa, but an Indian. Okay, so he, like who were taking care of, I think his grandparents, they brought us to, this boy to us, and I have given Shiro Vasti for that client on that, like a third week of the treatment. 3 weeks we have done the treatment.
Acha.
He was telling, now I'm totally out. Recently he came to see me too, and telling that, I'm totally, and I gave the herbs for like 3 months later, and the diet he was following, and he is doing his engineering in one of the universities in our
Good for
New
him.
Jersey only.
Good
Yeah,
for him.
yeah.
The question comes to my mind, Doc, is that Ayurveda, which is thousands of years old tradition, 5,000 years or something, and this kind of thing, Trigeminal Neuralgia or many other diseases which are coming into light recently. Recently, when I say maybe a couple of decades, 3, 4,
absolutely,
5
yeah.
decades or something. As a Ayurveda doctor for many years and practicing Ayurveda also at Santigram Kerala Ayurveda Wellness Center, USA, how do you find a cure? How do you find right herbs and oil and the Panchkarma treatment needed for this kind of cases, which was not there ages ago, but now it's there? So it must be a challenge for you to find right combination.
No, it's not that, see, everybody, like, see, North Indian Ayurveda is entirely different only on the herbs.
Achha.
South Indian Ayurveda, especially in Kerala, Panchakarma is a special Panchakarma which we practice. So I myself is from the 6th generation. So I was always with my father, I should say, he is my guru. Okay, so it was easy for me to, like, we know the herbs, I should say that.
Achha. Obviously,
And,
because you
yeah,
were the
because
doctor.
we were always there with my father, and seeing that how he has taken care of the, like people from very far distance also used to come. So we are versed in Ayurveda, and I have seen the results.
Okay, so you know the herbs, and at Santigram Kerala Ayurveda Wellness Center, USA, you actually bring in genuine herbs from Kerala,
Definitely.
from Kerala, India, and then
Yeah.
you mix it up with the right oil, different oil, because different
We
oil
get the
needed.
oils like that also.
Correct, but different oil needed for different patients and different disease.
Every disease. Actually, in Panchakarma, what we used is that everything is the oil also, and every oil is specifically designed for the diseases.
Correct.
Actually, like if you come for the low backache,
Ji.
so we see that which oil has to be used, what treatment has to be given to you.
Correct.
So that is why, like the pulse analysis is needed, and where it is that you treat for the cause, you diagnose the person through the pulse in the perfect way. Okay, so that you don't miss this treatment in any angle.
Very well said, and that's perhaps one of the reasons why Santigram Kerala Ayurveda Wellness Centers is the best out there for Ayurvedic treatment, herb and Panchkarma treatment as well. For this kind of treatment, trigeminal neuralgia, and a patients with this condition, right? How long the treatment lasts, and what should they really be careful about?
Very interesting question. Very chronic cases, what we do, like I start with the herbs first.
Ji.
Then, like a preparation for everybody cannot undergo the Panchakarma directly. So we prepare them. Especially here, everybody is working, they don't have time.
Exactly.
So, like with the diet, with the proper herbs, I start it, and I tell them to come. Some people, this the client and all, he came first week, then he told I'm going, like on a tour. official tour, then I'll come back. I told, okay. So I told him that the only thing, if you need only your medication, you take it. Otherwise, like unnecessarily don't overdo the things. Okay. So he told me that he was under so much of stress, but he managed without his painkillers.
Achha.
Okay. So that was a very positive. First, like they don't accept it. What Ayurveda will do, what Ayurveda will do. So it is like a counseling to make them understand what we do. Not only a consultation. Consultation anybody can give.
Ji.
Okay, but the point, it has to be, like brainstormed in their brain. It has to be understood by them.
And that's what we are actually trying to tell our viewers, that, should you have any kind of disease or any disorder, consider Santigram Kerala Ayurveda Wellness Center. And especially if you have tried all kind of medicines out there and painkillers out there and all kind of treatments out there, this is the time that you should really pay attention to Ayurveda and see how it can actually cure your disease. And God forbid, if you're just in the beginning stage, it can definitely prevent that disease before it goes too far. And that's what Santigram Kerala Ayurveda Wellness Center is all about. Dr. Nair, before we sign off, today's Ayurveda tips for our viewers, please.
Especially for the trigeminal neuralgia, that you should use, like we use very good oils are there, like Brahmi oil and all. This can be used for them. And you can take little bit of turmeric, like a half teaspoon of turmeric every day.
In a warm water.
Warm water, little warm water.
A little warm water, exactly.
And you can have like 1 teaspoon of castor oil every day at night before you sleep, and take warm water before you sleep.
Okay, so you don't take anything else with turmeric water in the morning.
No.
And then a castor oil at night.
At night.
Okay.
Because actually the Vayu is controlled a lot, and they will feel much better with this.
Very good. All right. Once again, Dr. Nair, thank you so very much, for helping out our viewers with this disease condition, and also letting us know how important Ayurveda is.
Definitely. Thanks a lot. Thank you so much. Stay healthy. That is the best prayer from my side.
And viewers, thank you so very much for watching the show. Thank you for your comments, and please do send in any questions, any suggestions you have when it comes to Ayurveda. Our email ID is info@santigramusa.com. That's our email ID. And every week we talk about a disease and the details on that disease and how Ayurveda can really help you to cure or prevent that disease. And that's what Santigram Kerala Ayurveda Wellness Center USA is all about. Thank you so much for watching the show. I am Sanjeev Pandya, wishing you all happy weekend ahead. Thank you.